Good afternoon, everybody. My name is Francis Kese Ngemba. I will present here my research work, which is entitled Awareness of the Health Adverse Effect of Tobacco Use Among Smokers of Nagombe Compound in Lusaka City, Zambia. As introduction, tobacco use is a major preventable cause of premature death and disease worldwide. The World Health Organization estimated that approximately 6 million deaths were due to tobacco-related diseases every year, and that figure was expected to increase by 8 million by 2030 if the current trend has to continue. Significant progress has been made in order to achieve a comprehensive tobacco control, especially in industrialized countries. That according to Brathwaite's study. However, Muller and Brathwaite has noted that a concomitant increasingly growing prevalence of tobacco use have been observed in developing countries. In Zambia, Oloski and Michelo noted the same increasing trend of prevalence of tobacco use in Zambian rural settings, while the prevalence remained unchanged in urban areas. In summary, the respondents of our study were aware of the harmfulness of tobacco products on the human health, and the awareness level was almost the same among male and female respondents. The level of awareness was significantly associated with the awareness the level of education was significantly associated with the awareness of health adverse effect of tobacco. In our study, the mean age of the population study was 23, as we'll see it later, and the mean duration of tobacco was approximately 5. So given that, it appears that the age of tobacco debut falls in the second decade of life. Therefore, public health intervention in order to curb the tobacco epidemic in Zambia should target teenagers. So what? Tobacco use is known to be harmful for human health. Yet, number of people continue to enroll in the use of tobacco products despite effort at the policymakers level. For example, the warning notice on the cigarette packs, the banning of the sale of cigarettes to minors, prohibition of smoking in public places, etc. Hence, the following questions have motivated this study. Are the tobacco users aware of the health adverse effect of this product? Are the different warning messages clear and understandable enough to the tobacco customers? If yes, what could explain the increasing trend of tobacco use in Zambia? The objective of this study was to assess at the awareness level of tobacco adverse effects on human health among young smokers in Nagombe compound in Lusaka, Zambia. Background. Nagombe compound is located in the northeastern periphery of Lusaka City in Zambia, with a population estimated at 92,000 inhabitants. Nagombe compound covers a total area of 12,000 square meters and is bordered by Roma Park and is situated at a radius of 15 kilometers from the central business area of Lusaka. Nagombe compound is made of an heterogeneous population given its close location to the University of Zambia. Method. A cross-sectional descriptive study was conducted for a period of 1 month, here March 2016, in Nagombe compound in Lusaka. And Nagombe compound was purposely selected for its close location from the University of Zambia, hence having a heterogeneous population. A convenient sampling was done, and only the smokers who consented to cooperate were included in the study. 97 respondents constituted our study sample, which was made of 79.5% of male and 20.5% of female. An evaluation questionnaire was designed for a face-to-face administration and an on-field interview conducted. Variables like age, gender, level of education, the duration of tobacco use, and the level of awareness were captured during the interview. The respondent was considered to be aware of the health effect of tobacco if he or she was knowledgeable of at least one adverse effect of tobacco. The data were then summarized and analyzed using Excel 2007 and Starter version 13.0 software. Result: the study included 82 males and 15 females. The awareness was found to be almost the same among the male and female respondents. The mean age of our respondent was 23.7 years, the younger being 15 and the older was 54 years old. And the mean duration of tobacco use was 5.4 years. Considering the mean age and the mean duration of tobacco use, it appears that in overall, the tobacco use starts around age of 18.3 years. The level of awareness was significantly associated with the level of education. And the following table and graph are showing the association between the level of education and the level of awareness. As we can see in the graph beside, we use the Pearson chi-square to test the association between the level of education and the level of awareness regarding the tobacco health effect. And as we can see, as the level of education is increasing, the level of awareness, or the level of awareness is increasing, or the level of people not being aware is decreasing and becomes even new when one has done secondary or tertiary education level. And we compared also the level of awareness by sex, and we found in our study that the level of awareness was almost the same among male and female. For male, it was 75.6%, while female had a level of awareness of about 73%. In conclusion, tobacco use is harmful for the human health, and our study showed that tobacco users are aware of the adverse effect of tobacco product on the human body. The study is relevant as it has shown that the age of tobacco debut is in the second decade of life, and public health intervention to be effective should target teenagers. Also, the awareness being associated with the level of education, this study suggests that investing in education will somehow help to curb the tobacco epidemic in Zambia. As recommendations and future step, we recommend that better policies to foster school attendance be put in place in Zambia, and that the use of other mediums like forums, TV programs, radio programs, etc. in vernacular languages in addition to written warning messages to sensitize about the effect of tobacco product. There is also need to do a qualitative study to understand the perception of smokers vis-à-vis the tobacco and to determine the motivation to starting tobacco use. And this is a list of some references I've used for my study.
Fantastic.